I should be better at this. I should be able to get this done. I shouldn't be feeling this way, right? I should have more faith, right? And this is kind of the echoes of the stigma that our church has had in the past. You think about, faith of the mustard seed. Maybe I don't have enough faith, and this is my fault, right? Maybe I've wandered too far from God. Maybe I'm not worth it. Maybe this is too hard. So lots of negative thoughts about the self, and it's all based on that off-kilter, like deficit in reality testing, right? And that's something that I want us to keep in mind as we explore just two examples from the Bible. So the first, I'm sure you recognize this Bible story. It's one of the ones that we learn as children. It's one of the more fantastic Old Testament stories of Elijah, right? So Elijah was one of the strong prophets of God. He had no fear. He went to King Ahab. He said, there's going to be a drought. The Lord is upset. Things are going to go down, right? And then it happened. This is the prophet that got a free food delivery service via ravens, right? This is the prophet that raised a boy from the dead and witnessed just self-reproducing bread ingredients during this drought. This is the prophet that proved to all of Israel that God is God in the most miraculous way, right? They had the altars there, they had the prophets of Baal, and fire rained from heaven, and there was no doubt that God was God, and this was God's prophet. This was the pinnacle of Elijah's career, right? And yet, what do we find Elijah doing right after this huge achievement? He hears that Queen Jezebel is angry and wants to take his life because of the drought, because of this huge miracle, and he runs away afraid. Now, Queen Jezebel wanting to kill Elijah is not a new thing. This has been going on since the drought began, but that reality testing is there. He leaves, he hides, he is afraid, he is hopeless, right? He tells God, I am alone, right? That isolation we talked about. I am alone. I am the only prophet that is left. There is nothing here. No one believes in you. This is hopeless, right? And this is despite knowing that there are a few caves of prophets of God hiding somewhere. This is despite all of Israel noting who God is. Elijah can't see it. Elijah is in the depths of despair, and he cannot reality test. He is hopeless, and there is no way out. He's deep into that black cave. What's more, he tells God, you should just take my life. I'm done. You should just kill me. Now, in my profession, that is called suicidal ideation. In his case, he's asking God to do it for him, so it would be passive suicidal ideation, but that's an indication of really, really severe depression, where everything is so hopeless, there's no way out, right? And yet, I want us to pay attention to how God reacts to Elijah, right? There is no reprimand. There is no, you should know better than this. You should do better. I just did that whole miracle thing. No. What God says is, Elijah, why don't you have a snack? Just sit down. It's okay. Here's some food. Why don't you have a nap? Food and nap. And then he invited Elijah on a very, very, very long walk, like a 4-day walk. And he had a moment with God where he heard God's voice. God sought Elijah where he was at with compassion and tenderness. This is how God responds to depression, right? Our next example, King David, also known as a man after God's own heart, right? This is the king that God chose out of all of Jesse's sons. He said, this is the man that will be king. King David is listed among the men of faith in Hebrews, right? And we all love David. Who doesn't love the story of David and Goliath? He's also had his victories for God. And what also we love about David are his Psalms. David wore his heart on his sleeve. When he was joyous, he praised and danced for God, worshiping God. When he was angry, he let God know. When he was depressed and hopeless, he also presented that to God. Now, just a few examples. If we read through the Psalms, and I noted this as kind of growing up, and I was like, this is weird. Sometimes David will kind of ping pong between verbalizing intense depression and hope, right? And I didn't understand that growing up, but it's David reaching for that hope, reaching for God's hope, even when he is depressed. But just a few examples, right? He says, Lord, my longings are sitting in plain sight, my groans an old story to you. This is in the Message paraphrase, right? My heart's about to break. I'm a burnt out case. Cataracts blind me to God and good. I just want to pause there because depression does this. That difficulty with reality testing blinds us to God. It blinds us to what is good in ourselves and in the world. He also says, just kind of jumping down, why must I wander around in grief, right? Why have you tossed me aside? It's that distance felt from God. Why am I discouraged? Why is my heart so sad? Now, we don't see a direct reply from God here. And yet we know through David's Psalms, through what he has written, through the way that he is remembered in the Bible, that God held him close, that God answered his prayers and was there with him always. This is how God responds to depression, right? Moving along to postpartum depression, things are just a little bit different. And that's because the postpartum period in a family's life is just so unique, right? It's a before and after. It's life altering, and it doesn't matter if it's your absolute first baby, maybe you've never even held a baby before, or if it's your 10th baby. Your life is one way before, and it's a completely different way after. Beyond that, there are a lot of responsibilities that come with babies. Turns out they need to eat like all the time, every 2 to 3 hours, depending on when they first come home, right? So no one is sleeping at home, especially if there are other young kids at home. That baby wakes up, they wake up, no one's asleep. Everyone is tired all the time. No one really has time to think or to eat. That's something that a lot of my moms tell me. I just kind of forgot to eat. There's a process of physical and mental recovery after giving birth. Breastfeeding is a whole new issue, right? Whether they're able to do it or not takes its toll. It can be painful. There's a lot of really painful things that come with having a new baby. And on top of that, the brain is just filled with to-do lists, filled with new baby information, whether it's, trying to count how many diapers the baby had because the pediatrician is going to ask me tomorrow, or trying to figure out, I have to, do this chore, and then I need to wash the bottles, and constant to-do list that never ends. And the focus changes from me being a woman, or dad being, a man, a husband and wife, to being parents. It becomes caregiving focused, right? And I put this poem here because I thought it was a nice little synopsis of what being a new mom is like, but we can move along. So because this is such a life-altering event, there's an adjustment period. And we like to call this adjustment period the baby blues, right? You might have heard of it before. It's often brought up in pediatrician visits and so on. And it has to do with that adjustment to the new baby in life, the new schedule, as well as this huge drop in all of the hormones that mom just had running through her system that are now all gone. Well, not all of them, but they drop significantly. And this happens to so many women, right? So 50 to 85% of postpartum women experience the baby blues. What it is just a really mild depression. It can look a little bit different for different people. Typically starts 2 to 3 days postpartum, and it goes away by 2 weeks after baby is born. For some people, it's just a little bit of mood lability. That means mood going up and down, like swings, and you don't really know what's going on. For other people, it can look more like sadness, like hopelessness that kind of comes and goes. It can look like crying spells, tearfulness. It can look like irritability, anger. It can look like, and granted, this is part of just being a new mom, really tired and forgetting stuff all the time, just can't concentrate. But the biggest difference is that it goes away and it doesn't affect your function, right? It's kind of like this intermittent thing, and you're able to get through. Whereas postpartum depression is a whole different story, right? It can look very similar, but it just kind of progresses and continues to grow. And again, it can look different for different people, which is an interesting thing. I really like this list here, so we can just kind of go through it and break things apart. What you first think of when you think of postpartum depression is sadness, right? Maybe sadness and crying, which is very common, but it can also have like these really big mood swings, right? Where one moment you're fine, you might even be happy and laughing, and the next, you're just gone. And you can't really tell exactly what happened, and things just feel like a mess, right? Excessive crying and crying spells. So back with the baby blues, there's like a little bit of crying, maybe a little bit of tears, and like, oh, what was that? And then it's gone, right? This is sometimes crying without reason. Sometimes it's just crying because you're feeling overwhelmed. I've had a lot of moms tell me, I push through the day because I have other kids, but the second I get into that shower, the second I go to sleep at night, I just cry and cry. And a lot of times that has to do with mom guilt, and those should statements that we talked about before, that meanness that the depression has towards self. We talked about the difficulty connecting with people. That includes baby, right? Everything that parents, right, have worked for is this baby. Baby comes and they feel nothing. They just can't connect. There's no joy, or there's sometimes with joy, but it doesn't feel the way you thought it would. Something is off, right? And this leads to tremendous feelings of guilt, feelings of inadequacy. I don't think there is one mom that I talked to that did not have mom guilt, feeling that they should be better, feeling that their baby deserved better, feeling that they weren't good enough because they couldn't breastfeed, they weren't producing enough. That's actually a huge, somehow it's just linked so much with a mother's sense of worth, is being able to breastfeed. And when things happen, or the baby's not latching or not producing, it produces such a huge sense of shame, right? And worthlessness, right? I should be able to do this and I can't. I should be nicer to my other children. I should be there more. All of these huge expectations. Another really interesting thing is that as a society, for whatever reason, we have this thought, I incubate a baby, I pop it out, I should know how to be a mom. Like the instincts will kick in and then we'll be good to go. But parenting is a learned skill. We have to learn it from somewhere. There's so many things that you learn along the way, right? And yet we give ourselves such a hard time for not knowing things immediately right off the bat. Next point, withdrawing from family and friends, isolating, that happens a lot. And with postpartum depression, it's even more, in the sense that there's a fear of contamination, right? They don't want to take baby out, so they have to stay home. A little bit more of an excuse, but that is definitely there, withdrawing from family, withdrawing from church, even maybe rejecting offers of help because connecting with people isn't there, and being with people can be hard, right? Reduced interest in pleasure and activities you used to enjoy. Now for this, it's a bit of a caveat, because as we talked about, New moms and dads are very caregiving focused. They kind of lose a little bit of that sense of self to become this like amazing parent. This lack of interest is when that space is provided. A lot of my moms would tell me, my husband wanted me to go get my nails done. I used to always have my nails done. He was taking care of the baby. He paid for the manicure. I went and I just couldn't do it. No joy. And she ended up just having one of those crying spells there, right? Because it just all felt like too much. So that's even when you're afforded that ability to maybe go out and walk, things, meet up with friends, things you used to love, and it just feels hard. That's depression. Intense irritability and anger. Now, here I want to pause just a second longer because for some people, this is the main symptom. Some moms might think, or dads, I don't have depression because I'm not sad. They might not have the crying spells. They might not be hopeless, but there's such an intense irritability and anger that just builds and builds out of nowhere. You know it doesn't make sense, and yet it's there. Maybe you're not acting on that anger. Maybe you're not yelling at your kids, yelling at your family, but it's there and it's bubbling and it makes your life impossible. Just that constant annoying, that constant nails on the chalkboard kind of feeling, right? That's depression too. Hopelessness, right? Kind of goes along with more of the sadness and going further and further into that cave. Not able to think clearly, poor concentration, poor decisions. This I hear a lot. And again, you kind of have to take it with a grain of salt because that happens normally too. But this is just kind of a little bit more than normal, right? So I've had a lot of moms tell me, I don't know what's wrong with me. I have memory issues because I just don't remember things. I can't get anything done because I start washing the dishes and I realize that there are clothes that I should have put in the hamper. So I go get the clothes to put in the hamper. When I get to the hamper, I realize that I should have put my keys away and the keys were in the hamper. So I grab those and I don't put the clothes in the hamper and I go and do something else. And just kind of that constant distraction, they don't get anything done. That can happen with depression too, as well as it's like the mind is really occupied with so many things. It's hard to keep track of littler things like keys, right? Restlessness can happen. Anxiety is very, very tied with depression. I feel like the vast majority of my patients have both depression and anxiety. They're just so linked, especially in the postpartum phase, because there's this inherent anxiety, this inherent worry about baby, just keeping baby safe, making sure you're going through that to-do list, right? And that anxiety can get really overwhelming really fast. Sometimes come with panic attacks even. Now, when we get to thoughts of harming yourself or harming your baby, that's when you've gone really, really, really far down into that cave and you're not really able to see the opening anymore. Things feel hopeless and like there's no out. This would be severe. And if this is happening, please talk to your doctor now because things can get better. Same thing for recurrent thoughts of death or suicide. Please talk to someone. We talked about depression looking all sorts of different ways. I like to think about it in a spectrum, right? Where it can look kind of different and people are in different places on the spectrum. On the one hand, there's this really high anxiety parent, right? Just so worried about baby's health. A lot of times this also comes along with some complications. I've had a lot of moms that struggle with anxiety that maybe baby wasn't able to breathe just at the beginning and then baby was fine. Maybe that baby had to go to the intensive care unit for a day or two. And this stays with parents, right? They're worried about baby. I've had moms tell me, I can't sleep at night because I have to wake up and make sure baby is still breathing, right? This is the intense fear that is just living inside of them, right? This is the mom that's going to, or the parents, I should say, that is calling their pediatrician at midnight, right? This is the one that's making all of those pediatrician visits just to be sure, right? This one also comes with a lot of feelings of inadequacy, right? Maybe I'm not enough. Maybe this is too much for me. Maybe I can't do this. On the other side of this spectrum is more of the hopeless picture, just kind of like I've gone too far into that cave. And I don't even have the energy to move, right? So that's when it would be indifference, that lack of interest that we talked about. It might even come with a negative perception of baby and just not even being able to receive help or support that's given to them, like social support, right? And avoidance. This would be the parents that struggle to make those pediatrician wellness checks. Maybe they struggle keeping up with the vaccinations or with other safety things. Right? But it can look a whole lot of different ways, and there's a spectrum. Now, in terms of paternal postpartum depression, is it a thing? It is a thing. We often associate the mom having depression because we know of all these hormonal changes that happen, and that is true. It is also genetically based and has a lot to do with life trajectory. Same thing for dad, right? There are some hormonal changes for dad too, and this is a huge life-altering event. And a lot of dads have postpartum depression in this new stage of life. It happens in about 8 to 9% of new dads. And it looks really similar to all the things we talked about for moms. And of course, it can look different for different dads. But the biggest thing is that dads tend to be more angry, right? Tends to be more that irritability, maybe even aggression, or just, this is too much, I don't want to make decisions right now. And that can be linked to the sense that dads feel like they need to protect their family. They feel like they should be able to manage things. And when they can't, the response is anger, right? And the risk of dad having depression skyrockets if mom has depression, right? There's actually a recommendation, which is not often followed, that new dads go to see their primary care doctor twice during new baby's first year of life to screen for paternal depression. It's hard to implement, though. It's easier to screen moms at their OB visits, right? But there is that recommendation. So why should we be concerned about this? Why is this a thing? Why don't we just kind of let it run its course and see what happens? So first of all, it has tremendous effect on mom and dad, right? We talked about dad. It doesn't tend to go away by itself, interestingly enough. Studies have shown that often moms and dads continue to be depressed even a year after baby was born, even when they're celebrating baby's first birthday with the smash the cake photo shoot, right? It doesn't really go away that well. It's associated with increased anxiety, right? Like I said, they're super linked. That social withdrawal, that difficulty connecting with people, losing friends maybe even, and relationship difficulties, right? Because they're not really able to connect to their spouse either. That just makes family life a whole lot harder. It also has its effects on baby, right? Actually, a lot of effects on baby. So as baby grows up, it's been, if mom or dad has postpartum depression, it's been associated with increased difficulties with attention and memory and language, all skills that are so essential for school learning, right? It's been associated with impaired motor skills, specifically like the fine motor skills, which is like the pincer grasp or picking up Cheerios or drawing, that kind of motor skill. It's associated with increased anxiety for kids, increased aggressive behavior. This is usually more on the younger side of kids. And then as they get older, there's that increased risk of psychiatric disorders. And it's not just mental effects on baby, it's also physical effects. So there's an increased risk as an association with physical problems like asthma, like colic and diarrhea, and a few other things I didn't write down. It's associated with stunted growth. So baby might not be meeting that curve that the pediatrician first thought they would be on. And sleep difficulties. right? So maybe baby would have been able to sleep fine and they're still waking up lots and lots of times at night. Just makes things a lot harder, right? Effects on parenting. So we talked about how the connection is often gone. So bonding is really hard. Attunement is hard. Attachment is affected, right? The way that baby relates to other people in their group, in their support system. Increased breastfeeding difficulties. And we talked about how breastfeeding is often just so related to a mom's sense of worth. There's reduced safety. So decreased pediatrician wellness visits, like we talked about in that one side of the spectrum, reduced car seat use, as well as the use of harsher punishments. Like that patience is just gone, right? This all affects the relationship and the child. So with all of this, there comes the question of when should I be worried? Because I don't know if this is normal or not. This is a hard thing to do. And that doesn't necessarily mean that, I need something. So this is just a little list. I tend to feel that if you're in doubt, ask for help, because things can get better, right? So for example, if life is just a little bit too hard, right? If you're having a hard time getting up in the morning and just think about the day and it's hard to start, if you feel like running away, right? My mom had this phrase, I think it was a song that she knew when she was growing up, that said, "Stop the world, I'd like to get off now." If you're having that feeling, something is wrong, right? If you're unable to function the way that you would like to, right? Like this should be easier. If that mom guilt won't go away, if those thoughts of I should be better, I'm a bad mom, my kid deserves better, I shouldn't be doing this, if that doesn't go away, it's time to maybe at least see someone, right? Because it shouldn't quite be that hard. If you're angry all the time and that anger doesn't go away, if you can't sleep even when baby sleeps, and we're talking nighttime. So sometimes when baby sleeps during the day, mom is like, well, this is my chance to get stuff done. That makes sense. But if night you're unable to sleep because of those thoughts of worry, because of those feelings of hopelessness, it's not going great, right? If you're feeling overwhelmed, right? And again, when in doubt, extra support is always helpful. And you don't have to figure out if it's normal by yourself. That's what professionals are for too, right? So what can I do, or what can the mother or the father struggling with depression do more specifically? So the first thing is talk to your doctor, okay? That can be your primary care doctor. That can be your OB-GYN doctor. That can be your pediatrician even, right? Talk to your doctor. Tell them what's going on. They can help screen to see, put a number maybe on what's going on. Discuss options, treatment options, right? Discuss therapy, the need for antidepressant medication. I'm just going to pause there because that's the part that I do specifically. I have seen such a drastic improvement with even small doses of antidepressant medications. It's like night and day. It does take some time, but it helps so much. It's not always needed. Sometimes therapy is sufficient, but especially if you've tried therapy and things just aren't getting better, I've really seen it help. The next thing that I would say is take a moment to breathe. When is the last time that you stopped that mental to-do list and just took a breath? Give yourself compassion, right? Oftentimes we're so lenient on other people and yet so hard on ourselves. Give yourself compassion. Know that this is not you. This is not a reflection of you. This is a common disease process that affects a lot of people, right? And then here comes some challenges, right? The next thing would be connect to your social supports, your church community, and your God. This is a hard thing to do with depression. you don't feel connected. You don't want to go to church. You don't want to talk to your mom, to your best friend, maybe. Maybe you don't want to open up about these things, right? And yet, doing so can make things a lot better. It can help. Talking to God can be hard with depression. You feel like God is far away. You might even feel like it's your fault that God is far away. And yet, don't stop praying, because God is right there, as we saw with Elijah, right? As we saw with David. God is there with compassion. He is there for you. Take time for yourself as much as you can, right? And just like God did for Elijah, sleep and eat. So many moms struggle with this part. Take a moment for a nap. Take a moment for a meal. And do something that you enjoy, of course, within the limits of the things that you can with your time. You might not want to do the thing that you enjoy, but doing it is helpful. It's one of the first steps, right? In my world, it's called behavioral activation. What can others do for me? What can the community do for a mom or a dad that is struggling with depression in this time in their lives? The first thing would be to check in with new parents. A lot of times we think, oh, they're just so busy with the kid. I don't want to bother them. They're probably not sleeping. They're probably just doing this or that. We'll talk the next time you see them. I encourage you to just check in, even if it's a minute, 2 minutes, right? And listen for what they might need. I oftentimes, and many people, when you're talking to someone and they're going through something, say, let me know if you need anything, right? But most people never let you know if they actually need something, because it's embarrassing, right? It feels like a flaw somehow. Sometimes they might not even know what they need. It might just be too overwhelming to know what they need, right? So listen for what they might need and provide empathy without judgment, right? Everyone is on their own journey. They are going through their own struggles. We provide empathy just like God does. And use your God-given gifts, right? Maybe you are an amazing cook like my mom, and you can make this gourmet meal or just even a home-cooked meal and give this family a home-cooked meal. Maybe you are able to babysit. Maybe you can take care of the other kids for an hour, right? Or somehow provide mom a day out, or the parents a date night. And even then, if you're just able to give a hug and a prayer, that can be powerful. Don't underestimate that power. Power of prayer, as well as touch, right? There are things that we can do as a community. Now, to wrap things up, let's see, am I still good on time? To wrap things up, things I want you to remember from today. Postpartum depression happens to a lot of parents. Fathers are also at risk. I encourage you, especially if you're not feeling great or you feel like something's off, talk to your doctor. They do suggest screenings for you too. And if you feel like you're struggling, please reach out for help. And that would be for your benefit and for baby's benefit, health for both of you, right? And life can improve significantly with treatment. Things can and will get better. I've seen it get better lots and lots of times. So there is hope. Thank you so much for listening to me and coming today. I really appreciate it. This is something that I'm very passionate about. And any questions? Wanted to make sure that I left time for questions if anyone had any.
Well, thank you, Dr. Lisa, for the wonderful presentation. This has been very insightful, and there's a lot that we've learned from this today. But before we go into the Q&A session, I want to do a little translation for those of us who may not be adept with English, mother tongue or English language, so we can translate it into our local dialect so people can really understand what we share today. And then after that, we go right into the Q&A session, if you don't mind. Okay. And see, nyamnom edamase se biom so masa beka ye ho, and then yesua de and addition yesua na efa awachi adwunum hawa na adwunum yare amanfo eta enya ho na and aboni be kind of say postpartum depression now, but in most times or starting or can be which Thomas Mpai or me say depression wo we and as adwunum say adwunum yare kan wasem no enya obi and onyi obi amfrim any impegni mbofra and it's no dem faton say Elijah mpo na ono a oni nyankopon nam no du ba bi no or onya sa hawo no ema enti no okase nyankopon kwai de enye ne confidence because we bre and it say we are not immune as like ye ne ye ho emfisa obi abetime nya bi na then na ne dey kan asempa na oka about awachi ho sa adwum hawo no and okase empempi no esan say ye nya ni bafoforo e wabusian no ntino eto da atete kakra eba if you say ebia first no kutum koda no nso no sorry no apa no nsia na akwadum but now no say no abofra no aba no ebia every 2 or 3 hours bia no obesu apaduane obesu ayesi obedwonso obeja ne nan so san no saa ne man ketenketen na ebobo ano etima e stress and I said the stress bama and I'm so etima depression ba na ochre mu no o me tete say the kind depression na a spectrum na say enya ade baako neme grube a ebobo ano na say the emre no and kire the cordial potia enti na obeka say broni beka say there's a spectrum and I said ahodo bebrebe na say bia owo na odi na mienu ana miensa chi a eno no your friend baby blues no and depression na by just say we there and chair piece na say eno no about be na ochi mienu achi after a war no etimi ko eno akasa beko I guess I was say anko na say twaso after bed na ochi 9 achi no your friend of postpartum depression after na be depression na kasa be adwene na kasa na then na yehu so obinya sa adwene haro bi after a war then yehu ebeto ba say ni bako no afi na ohwa na raho bibi anya no so na raho ohwa sa na buafu ohwa sa na bibi kitikisi bi na buafu ebu ho nso a na maame no wonya adwene be say afi abofara ko na ompe ne biem ede na owo ye oni no so owo ye na say otete basa na ni nyina ye nso a depression ye deba na enya ema no nko a enya omo mema no nso the husbands also get it and into no baba for no nyina no ehia emwa na oto aso biem no o memo say the person make more o to oyimpa say ni we nyina achi ne emfa ho ne obokodu wo sa adwum hawa na say bi o sa nso nyina the energy say won say emwa ewo ho emasa ni papa no and it say unya sa symptoms ya na say unya sa yi bia ne ma boss bia na eno doctor any home komo na onhwe how obesi aboa wo ebiem so no reach out to people any afro on kasa because I area no e can she ena ema unya ni gie say oni boko ni pam kra you don't feel like going out and unya ni gie say boko na afro akọ united and we are first na akọ aso ebe na aso kwa anya wakono ye kwa yi onko ye kwa bedi nto onko bibia no aso wate ho na e basa nso be ena de bagusia no so e nso de ba na say e ma abatete kra na ayeden ena mankabom e wo busia no so de esote na we nyina na yade a edi nso e ba abusia no mu na edan ena yen so ye wo fi de betima ye nim say ye amamro mo to da adwumiare na ye nyintum sa ye say o we onye bema nsuni sa na mane nti ebibisa obi nya sa yare bi kwa na on pese obeka because onso oka ebia ye besere na say emfa ne breko aso but I say you say yare na ewo ho na ebetima ye obi a nti say obi ohun so obi nya sa yare me so ohun so obi nya sa sentence bia ana yi bia dikaya makan nyina bia bo modern so be pinche nipa no na obaka chen say me wo homa de ohia bia na meboa ana say obekire no kwan akodo obi doctor bi nchen na doctor na dey aboa nti kakra meka afa ne o kire ne nyina no enti meja atum na say wo question And I say, oh, I say, Missa, Obetima Busa question no brofo, and I will talk question no Chika sem, Ebiano, Obusa, a better as the Tiacobafuna on so yanti, Major Pronato, Ubuasa Missa, or Mount Sasua, a mouth. Raise your hand or mute and ask your question, and then Dr. Lisa will answer you accordingly. Thank you. Dr. Lisa, so now we open the floor for the Q&A.
Sure, yes.
Sure. We say for Pacha or as a bit more months, so now Obusa. We're also waiting for the answers. I have one for you. Okay, I think somebody's on the line. I'll let them go first and I'll ask mine.
Yeah, Doctor, so when you were talking about the postpartum depression, you talked about hormones dropping considerably after childbirth. Is it the cause or?
So it's not the cause, but it's something that contributes. Let me see, I actually have here. So this is a graph of the hormones, right? So the hormones drop in every woman. The difference is that for some women, they are more predisposed to being affected by this, right? So there's this drop in hormones as well as this genetic predisposition, as well as other life events that affect that genetic predisposition. And aside from just these hormones dropping, specifically in the postpartum phase, one of the things that the placenta, one of the hormones that the placenta produces, helps control the anxiety axis in the brain. So it kind of helps lower that, right? That response, that cortisol response, right? So when the placenta is gone, that hormone that helps keep that a little bit lower is also gone. And as a result, the anxiety and that vulnerability emotionally increases quite a bit just from that hormone change. But it is very genetic.
Okay, thanks.
Does that answer your question or any other concerns?
Yeah, I'm okay, thank you.
Sure.
We're still waiting for the questions. If you have any question, be it in English or Twi, just speak it out and Dr. Lisa will answer you accordingly.
Okay, Dr. Lisa, thank you so much. My question is, I think you mentioned that every woman has it, but sometimes not all of them show that they have postpartum depression, right?
So it's very common to have mild symptoms, especially in the first 2 weeks. Not every woman has it necessarily, but it's very common because of that adjustment period. However, not all women go on to develop full-blown depression. That's about, it was 1 in 8. I'd have to look up the statistic again. But that would be a much more severe form.
So not everyone has it. Oh, all right.
Not everyone, no.
Thank you.
We're still waiting for the question. Thank you, Dr. for the answer, and thank you, Auntie Akumisa and Mr. Samuel for the questions. While we're still waiting, Doc, quick question for you. So let's say a lady or a woman has depression prior to pregnancy. This is she has a condition already,
Yes.
and then she's going through pregnancy. Is that still postpartum depression, or is that depression? How do you consider that, and how is the way forward? Do you treat it whilst pregnancy, or what?
So the timing of it changes the name just a little bit. If they have depression prior to getting pregnant and that depression continues throughout pregnancy and into the postpartum period, then that would be general major depressive disorder, right? If it starts during pregnancy, that would be peripartum depression. The name just changes a little bit. But one thing that is very true is that if you have had depression before, you are at higher risk of having postpartum depression. And if you've had postpartum depression before, you are at significantly higher risk for having it again.
Wow.
Thank you. Before we still some misano and answer or like any questions or what be it a contribution or question that you have for the doctor, we're still waiting. Now, also when with regards to treatment, what do you say? Do you recommend that social support is more effective compared to medication, or is it the vice versa, or is it both ways in terms of treating the depression?
Social support is needed in any family, right? It takes a village. When it's depression and it meets criteria for depression, we need to take treatment a little bit more advanced, right? So if it's mild or moderate depression, and when you talk to your doctor, they can kind of help determine at what level they think you are, it's okay to start with just therapy. And there are different kinds of therapy. It's usually weekly therapy. There are also a lot of support groups that can be very helpful. Once it's severe depression, or let's say that therapy didn't help, it wasn't enough, we need to start thinking about medication. And what I mean about severe depression is unable to function, having thoughts of harming self, having thoughts of harming baby. We need to take that very seriously. And the first line of treatment would be antidepressants with SSRIs specifically. That's the name.
Great, thank you. Right, do we have a question in the chat? It says, what about when miscarriage occurs? How does that tie in with the depression? Where do we figure in? What is the way forward?
Yeah. So yeah, it really is. Miscarriages are devastating, right? Because that bond is already made. In terms of the nomenclature, I think there's a little bit, the jury is out, right, as to whether that's still considered postpartum depression. And that has to do with not all of these hormone changes occurred versus calling it major depressive disorder. Both would be treated the same way, and both would address this major stressor that happened, this major crisis in life that happened, whether it be losing the baby through miscarriage or adjusting to baby.
All right, thank you. Okay. There's another question in the chat says, what can our pregnant women prior and during pregnancy do to prevent postpartum depression? Like being more proactive, what can we do?
That is an excellent question. I think one of the best things that you can do is bond with baby. So there are different ways to bond with baby, talking with baby, even while in the stomach, right? Singing to baby, reading to baby. This all starts a bond. And we've actually seen that the fetuses respond to when mom and other people talk to them. So that's, I think, probably one of the easiest things to do. Another thing would be to do some therapy, some personal work for oneself, understanding one's own experience with their family growing up, the way that they relate to other people, the way that they want to relate to their baby, right? That would be more attachment-based therapy. Would be very helpful. And then if there is a history of depression or a history of postpartum depression, starting therapy or even starting medication during pregnancy can often help prevent postpartum depression.
Great, thank you. Thank you so much. That's very helpful. Yeah, any more? Okay. Another question says, do you know the percentage of women of color with postpartum depression?
I don't know the percentage of women with color.
Mm-hmm. Okay. Now, as a follow-up to that one, what is the effect of social disparity on postpartum depression? Does that play a role? Is there an associated correlation? Mm-hmm.
It does in terms of risk factor, right? So there are a lot of things that increase the risk of postpartum depression, depression in general. One of those would be poor social support and poor financial support, right? So if you're struggling to make ends meet, that anxiety and those stress hormones are going to be a lot higher anyways. That can predispose to postpartum depression. If you're a single mom, just a working single mom, and you're just alone in the world, that's going to increase the risk of postpartum depression. And so it is more common in lower socioeconomic status families because of that inherent increased stress.
Great, thank you. All right, and another comment says, as Africans, we hardly talk about miscarriage, especially when it occurs earlier without physical signs like the tummy or pregnancy. What advice would you give to women going through like miscarriage or stuff?
There it is. First, I would say my heart goes out to you. And oftentimes there can be a lot of shame associated with it, right? If this happens, I encourage you to reach out to someone, whether it be a close friend, a church member, and potentially even a professional, to be able to talk it through, to be able to process it, and be able to continue with life with this pain. It's a very difficult journey.
All right, thank you so much. Just to respect your time and the time of our audience, we'd like to bring into the Q&A, and also Doc. I see you're already online, so I'll leave the stage for. I know we have. Thank you so much, Dr. Lisa, for the education and insight tonight. We've been really blessed by sharing, and we will take to note what you've taught us today and put it to good use. Thank you so much. Thank you so much for coming.
Thank you.
Sorry, Pastor, if you're there, can you take over from now to bless us with the words of life? Thank you.
Okay. Thank you, Dr. Lisa, for the wonderful presentation, and thank you also for the insights you brought to bear from the Bible too. We thank our audience and our church members also for listening and sharing, and also for the questions you asked. What I want to share is briefly about what God gave us as our bodies. Is a precious gift that we can get from a loving friend. God is loving, and he gave us this body that is so incredible, full of power and abilities. The Bible teaches that our body is a blessing. Our physical body is never evil, because according to Genesis 1, verse 1 to 31, God saw all that he has made, including our bodies, our physical body, and everything was very good. So it is evil which resulted from rebellion against God, not from the fact that we have a physical body that makes the pain, depression, and all that we are sharing surface in our lives. And what I want us to notice that even though sometimes you may think that what we have is not perfect. Yes, because of sin, things are not perfect. But we don't need to punish ourselves, our bodies. We don't need to punish our what we have been given as a gift from God, because in some spheres, people use so many things to punish the body in order to release the soul. That is not what we believe in. We believe that with science and the Bible, we can do far better than what we have today. So what I want us to take home is that your mind, your body everything that is in you, God formed you and gave you what is best. So we have the best gift from God, and we want to take good care of it, and we want to be blessed. Many other folk. They may kind of numerate and say, so already yesu and any eka ho asem no a. So da na ye ya ba badwene sa ase ne pedua no kra enye our physical body no kra yam so how wo ho ne ade. Nyame asem kire nse ye achede nyame de ma yen odo ye nti no de ma yen. One of the best gifts I betumi enya awasase so. Any baby a your body is so incredible. Nyame ade odi hihye ne pedua no amane ye nwanwa na efe. So how wo yi kra ye ka ho asem a said the nyame hihye nyinsen no ma oba kan no fem no wontumi nti ase. Ade se firi nyame a oye odo nko a. Enti ni a ntinsaso aba no nyina ne ye boni a yetie Satan na de ba yen so ano na de ye fa sa how ni nyina mu. Nyame mu gidie ene adesua yesua se ye de ye ho to so a ebeboa yen ama na siesie yen ye ne beji ye ho even though how no mre no be ba de nyame ebema ye kwan ama yetumi adwane afiri ho ti nyame nhyira ye nyina onti na ene mu nkyere na wonsiesie yen abra ye de ye ne to Bible ne so na ya follow science akwankyere de ma yen no put together no ye ne beje ebe ye nhyira nyame nhyira won so wo join ye nwumrei na woni yesua ade nyame yadma wo kyena so ye beto aso nyame nti we have hope and it is so wo say ebe ye nyame nhyira ye nyina wo Yesu din mu amen.
Amen. Pastor Yedawase for the word, so sweet. All right, Dr. Kwame, let's show announcement be over and opening their mind now at also.
Okay. Indeed, yeah. First of all, we that we want to thank Dr. Lisa for the presentation. I was amazed about the connection in the Bible, and I think as Daniel said, it's like Obia Tininyebi. So I think it was good. We want to thank her for the presentation. Before we end up, I know there are a lot of names here, but I can see Carlos. I would like to recognize Carlos. Thanks for coming. And then also we have Peace. So so Carlos, that's Dr. Lisa's parents. Thank you very much for joining. Yeah. And then also we have Mrs. Sarah. Thank you for coming. We saw she joined us yesterday, and thank you for today. We hope that you join us again tomorrow. I see Peace, and all others that I can't see your names, but you are here. We want to recognize all of you, and we want to appreciate all of you, and we hope that you join us tomorrow. So tomorrow, now we finished the women health. So we are transitioning to physical health. So tomorrow we have, tomorrow is going to be special. You know, it's Wednesday. So Wednesday we have prayers. So tomorrow, the first 20 minutes, we're going to spend time to commune with our God. We're going to have Wednesday prayers for 20 minutes. And then after that, we have Captain Richmond Sapon, who is a physical therapist. He's captain because he's he's a captain of Ghana Army. He's a physical therapist, and he's currently a student of Doctor of Physical Therapy at Loma Linda University. So he'll be giving us a topic. He'll be presenting a topic: microdose physical activity. Microdose physical activity. I don't know what it is. I believe that we'll all be here tomorrow to hear him and find out what he's about, what microdose physical activity is about. Thank you very much, and we will see you tomorrow.
power to save. When this Holy Spirit's stubborn tongue is ransom from the grave, is ransom from the grave, is ransom from the grave, is ransom. When this Holy Spirit's stubborn tongue, this Spirit's stubborn tongue is ransom from the grave. Hallelujah, is ransom from the grave. Ransom from the grave. It is ransom from the grave. From the grave. When this Spirit's stubborn tongue is ransom from the grave.
Right. Agile for your best friend. Na mahu say your what you say. Miss I say Auntie comments and Auntie Elizabeth. Oh, so I bet my bompire Ashra legend so am I.
I'm to my mom. Yamini Bank is the music to us. Thank you for the message that we have received from Dr. Farah. We pray that you help us to be able to utilize the word tonight, and also thank you for Pastor Jiboli. Thank you for all that you have done for us. Tonight we pray that as we go into sleep, that you let your angels watch over us. And then by your grace, and we another day to see. If you come and bring your hesitation, bring your thanksgiving, and also bless your name. Thank you, Lord, for this evening. Thank you for Dr. Kwame and all the other participants who are helping to actually put this program together for us, that we can benefit. Thank you for the knowledge that we have received tonight. Bless us, Lord. We have prayed in Jesus' name. Amen.
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 Amen. Thank you all for coming, and we look forward to seeing you all tomorrow. Shalom. Dear Miss Pa.
Then tomorrow.
Recording stopped.